So I'm Clare Parker and I'm the Acting Chief Strategy Officer. So I'm going to start by talking about our redevelopment. And this really was the year when our redevelopment really started to come to life. So just go to the next slide. So during 21-22, we engaged on our clinical brief and vision, went out and spent lots of time talking to people, developed our detailed plans for the new building at each site, and confirmed that our preferred option is for a full clinical rebuild at Watford. And we've secured outline planning permission for Watford and have planning applications in at the moment for both Hemel and St Albans. Next slide. We also really were able to show some demonstrable progress. The picture's not quite coming up there. This is our Watford site. The new build will be where the old car park was before those sites, so existing services will continue while the new build development. Thank you. So as has already been mentioned, we opened our new multi-storey car park, and we've also started enabling works on the site, so redesigned some of the car park at the front of the hospital to enable us to move our pathology building ahead of the redevelopment. And I think after so many years of having to operate within poor estates, it's really exciting to be able to see things starting to happen on our sites. And we're hoping to receive confirmation of our funding envelope later this calendar year. So just moving on to the next slide, talking about strategy. Our plans for the future are much wider than just new buildings. As you've already heard from Dr. van der Watt and from Paul Bannister, we're going to innovate services and use digital technology to make sure our services are as forward-focused as possible within our new hospital. And to do that, we've established our 5-year change programme, Better Care Delivered Differently, which has 5 clinical themes supporting our clinical strategy, underpinned by our workforce, digital and redevelopment programmes. So the next slide is just going to talk about the partnership working that we're involved with. So we know our patients don't just receive services from us, we also use GPs, district nurses, social care, mental health services, and to make sure people experience really seamless care and get the best possible outcomes, we are working together with our partners to enable us to do that. There are a range of different ways we work with partners. So the first is the integrated care system, which is the widest partnership across Hertfordshire and West Essex. And it's responsible for setting and delivering plans to improve health and reduce health inequalities. More locally, across South and West Herts, we are leading our health and care partnership, which is focused on improving delivery of services and improving outcomes for patients. And we've done several things this year. Again, we've already heard about the integrated virtual hospital, but we've also been looking at transforming respiratory services, diabetes, and for people with frailty. We've developed an interim strategy, and we've also developed a partnership agreement setting out how we'll work together to achieve our shared objectives. We've had for some time a clinical partnership with the Royal Free, and that's enabled the electronic patient record to be implemented much more quickly than would normally be the case. We've agreed to extend that partnership for a further 3 years, so we'll carry on maximising areas of collaboration around clinical services, digital estates, and also look at other ways to join up services between our ICS and theirs. And finally, we're also working more closely with our other acute trusts within the ICS, the Princess Alexandra Hospital and East and North Herts Hospital, to help reduce waiting lists and to strengthen some of our smaller services. And then finally, I'm just going to talk briefly about the Green Plan, because we all know the environment is a key concern for everybody, and the NHS is committed to net zero carbon by 2040 for the services we deliver. We've published a Green Plan which has 9 areas of focus, and what we just set out on this slide is some of the areas on the left where we're doing particularly well. So since 2018-19, we've reduced our NHS carbon footprint by 7.5%. and we've reduced anaesthetic gas emissions by 32%. But on the right-hand side are some of the areas we know we still need to tackle. So we need to do more to reduce, reuse and recycle the things that we purchase. And we know that travel is a large emission source across the NHS. So we're also working on travel and access to see how we can help to reduce our emissions through that route.